Gonzalez, and I'm the consultant working on the behavioral health training series for King County Health Department. Thank you for joining us today. Our session is Art in Therapy, Ethical Considerations for Non-Art Therapists. In this program, we'll gain a deeper understanding of the field of art therapy and the use of art in healing. This session is part of our monthly training series hosted by King County Health Department to support a stronger behavioral health system in our community. We're very pleased to welcome Peggy Carstensen with us today. Peggy is a licensed clinical professional counselor and a registered art therapist. She has over 13 years of experience, and she holds a master in art therapy from Mount Mary University. She specializes in creativity-based techniques for trauma. Her background includes work in inpatient, school, community, and private practice settings. Peggy is a clinical therapist and the clinical director of Graceful Therapy in Oswego. She practices equine assisted psychotherapy, Brainspotting, and traditional talk therapy. In addition to her clinical work, Peggy is also a published illustrator and a mother of 3. And her diverse professional and personal experience just brings richness to today's session. Today, we're also being joined this morning by Spanish language interpreters. And then to access the Spanish audio, just please click on the interpretation button at the bottom of your Zoom screen. This session is being recorded and the recording will be available on our website. And then we'll take a break around halfway through, around 10 a.m. CEUs will be available and we'll place that link in the chat once we get started. And with that, I'll turn things over to Peggy.
Hello, thank you. I'm really excited to be here, despite the I think I got all my nervous jokes out beforehand as we were making sure tech was working, but hopefully this is not the most dull presentation you've ever been to. It's I was describing this as sort of my mini soapbox over the years, but with love, because as an art therapist, I hope I speak for all art therapists and artists that we all want everyone to be using art as much as possible and making and creating. And there are things to consider when you're bringing that into a therapeutic setting. See if I can click away. So thank you to Kane County Health Department, especially Courtney and Bianca, for kind of getting this off the ground. As she said, the goal and hope is for everyone to walk away with a better understanding of art therapy and what distinguishes it from traditional art making by yourself or art class or art in therapy as just a healing moment. And for you to have more confidence in incorporating it and bringing it into your own work that you're doing. This is the slide that proves I know a couple things. She kind of already went over that, but I'm currently the Chief Clinical Operations Officer at Graceful Therapy. So I'm overseeing all of our clinical functions, whether that's the business side of things, but primarily our staff and our clinicians to make sure they're doing the most ethical work, that we're avoiding burnout however we can. A big part of my job is being fun and connecting everybody and making sure we do things that aren't just heavy, hard, traumatic work. I do not claim to be an expert in ethics, but I do reference a lot of the ethics today, obviously, and those can be found online. And I have the links to those where you're getting the word for word ethical pieces. But we as a practice are ethics first. We want to do the things that are right by our client and the most legal and sound, and we consult with professionals whenever we're not sure. So I'm so grateful for my role, and I still get to do art therapy, but I also do some oversight and supervising. Objectives, again, understanding art therapy, thinking about the ethical issues and recognizing what you should consider when you take out those art materials with kids or families or adults you're working with, really just pausing and thinking a little bit more after today. Recognizing limitations with any therapeutic approach. If we're not an expert in something, either getting consultation or referring out is most appropriate, but also just thinking through, you may be absolutely capable of working with that client, but what are things to remember, like displaying and storing client art? We'll go over that. Increasing your confidence, as I said. And then I really want us to share practical or tangible exercises that work really well for you or that you've tried, I have a list of my favorites that I'll share with you, but so that after today you can feel inspired to be like, I should really do that with that kiddo. That might bring out something different from them. So, what is art therapy? Like anything, we got to start at the beginning. I won't pretend to be teaching you an art therapy course to um, to cover everything, but I think it's helpful to acknowledge the roots of art therapy and where it came from as a field and as an approach that is medically acknowledged as healing. Our credentials still don't stand alone. So I'm a registered art therapist, but I can't bill insurance as that. So there's still work to be done around this in itself is medical enough for insurance to pay for it. So I have my LCPC in addition to my art therapy credentials. I won't read the entire definition. It's obviously pretty lengthy, but it's an integrative mental health and human services profession that enriches the lives of individuals, families, communities through active art making, creativity, applied psychological theory. Um, Kind of down at the bottom, I'm bolding that it engages the mind, body, and what word is underneath there, my camera, and spirit in ways that are distinct from verbal articulation alone. So one of the things I'm really going to cover today too is the magic of art therapy really being in the nonverbal component of it. I am a very verbal person, but my work that I do that I find most healing and powerful and the passions of the helping field that I have are the nonverbal approaches, the equine therapy, art therapy, brain spotting. The thread that connects all of those things is how we're activating the brain without words. I feel really strongly that there's limits to how much healing can take place from someone telling their story over and over, and there are often not words for something someone's gone through. So art allows the client to get that out on the page or get that out through any kind of material, bring the problem outside of themselves, view it from a distance, not see themselves as the problem. And there's magic or synapses happening in the brain that we can't achieve simply by talking about it. So I love this slide because I was describing to Courtney and Bianca before this, when I worked in a psych hospital, I was often considered the like fun aunt. Like I'd come rolling in with my art cart and I love being fun and I am an aunt, but wanting to be taken seriously and for clients to view this as a healing space, there's value in the occasional, like, I tricked you into attending therapy for those resistant clients that it really causes a reaction if they know they're sitting in therapy being analyzed, or they've been to it over and over and over. And so they just want that non pressure space. But in general, when we talk about art therapy, the sense of it being valued for what it is and not just lumped in with making art in any setting. So the differences between a class and art therapy being it's facilitated by a professionally trained art therapist versus a teacher or instructor involves a therapeutic relationship. In a class setting, it's a student-teacher relationship, which we know is a very different dynamic. It takes place in a confidential space is a big component versus a studio or a classroom that we know is often interrupted because of just the chaotic environment of a school or a classroom. The main goal being self-expression in art therapy. And in a class, we're generally going to learn how to make something, to know either step by step or learn new skills around it. The art supplies are tools for self-expression in art therapy, where in a class, you're using an item to accomplish a task, not seeing it as an extension of yourself or a healing tool or a therapeutic tool. There's no right or wrong way to make things or use art materials in an art therapy setting. So that throughout today, I'll kind of point out common whoopsies that happen with art therapists as well, but especially for someone who doesn't have knowledge about art therapy in a therapeutic setting. And that right or wrong is one that we're so trained to view art as it should look a certain way, it should be beautiful, or we want it to look a certain way. And while there's nothing wrong with that, that your client usually wants to make something beautiful also or like what they made, remembering that that is not the role or the goal here. And so saying things like, oh, that looks really pretty, or that turned out how you wanted it, or just the language that we use is so impactful. And there's a lot of implications with art making about something being right or wrong, or good or pretty, or worthy of being valued or honored. Um, Again, it's no one's fault that that's how art is often seen. It was a big transition for me when I went to grad school to let go of the painting major mentality of one of the biggest examples I have. I remember saying like, but like collage isn't like real art. And colleague or other students being kind of appalled by that. And now I'm appalled with myself, but it felt just like, well, you're just taking other images and putting them together. Yeah, and there's absolutely value in that, but I was so stuck at that time in the rigidity of, um, feeling like it needed to take hours and hours. My background is oil painting, so it felt like, you know, it should take a long time and be difficult and look a certain way versus the beauty and power of creating no matter what the material. So sometimes we have to untrain those viewpoints of especially beauty and whether an artwork should or needs to be beautiful. The focus, I probably heard this phrase, I'm not exaggerating, 4,000 times, if not more, in grad school, that it's about the process. So, art therapy, inherently, like the core of it, is it's about the process of art making. We're not analyzing the artwork as a diagnostic tool. There are some interesting diagnostic drawings or activities that are used to sort of check in with how a client might be doing in a certain area, but should never be used to say like, oh yes, this client was sexually assaulted because they drew this picture that involved this private area. Like that's not an appropriate use of art therapy. When you see trends or images that are alarming, of course we address them and I don't want to say dig deeper, but we ask questions around it or assess for safety. But the art making experience and the art itself is not used to diagnose a client. It's about that process of activating the brain, using nonverbal approaches, learning about themselves as they create. You can learn a lot from clients if they're really hard on themselves while they're making art, or even within yourself. I found that some people don't incorporate creative modalities with clients where it would be a great fit because of their own feelings of, well, I'm not creative, I'm not skilled, I don't have the right to do that in session, I'm not crafty. Um, that this is really about the process and either engaging to have fun, to learn about themselves, but not focusing on how it turned out is the main difference between therapy and an art class, where not that we're in a critique setting always, but the idea is usually in a class about how is the product? Is it visually pleasing? Artwork is seen as a reflection or extension of the creator and is used for communication. I'll get more into that later too about when we're storing or viewing artwork, seeing the artwork as a piece of your client, an extension of them, a reflection of them, versus artwork being evaluated for formal qualities like design, perspective, color. Those will come up in any art making setting. The biggest piece being mindful of that, of not overemphasizing or you being the one to lead those observations. So when we talk about art in a therapy setting, it's very observational and neutral versus like, I really think that's so pretty. It doesn't matter if you think it's pretty. That's lovely. And if they are asking for your input, of course, we're not trying to hurt feelings, but just pausing before we share something that we think will be well received just for the sake of kindness. Of course, it's well intentioned, but is it limiting where we can take the art processing? And usually the answer is yes. Another really great graphic I found is art therapy versus therapeutic art. And I don't love the word versus because they all have value. I say in here later that art therapists don't own art. We never have. It's not that we don't want people to be making art with clients, but it's something that has come up nonstop since graduating and receiving my master's in art therapy, but then especially as a supervisor, supervisees unknowingly in their note calling themselves an art therapist by saying therapist conducted art therapy. they're not advertising themselves online as I'm an art therapist, but they're identifying it as though they're trained versus acknowledging that we used art making as a tool, as a therapeutic intervention. It's subtle. And again, it might just be my soapbox, but today will hopefully help you understand why that distinction is important to protect your client, protect yourself from labeling what you're doing as something it's not, and almost trying to implement some of the more art therapy rooted strategies to reduce that risk. So, art therapy requires a licensed art therapist, is psychotherapy, so involves all the same training, background, integration of models, learning the history of the field as other approaches or other licenses, assesses and works through mental health struggles, and helps individuals learn coping skills. Therapeutic art can be done alone, which is awesome. You're giving your client a coping skill to walk out with. If you do an art exercise in session or you encourage them to do that on their own, that's a coping tool they're doing within themselves and can do at any time, potentially. That's not art therapy. A lot of us have a love-hate relationship with the boom of adult coloring books and mandala coloring books, and some of them are labeled as art therapy. Ooh, that's not art therapy. It's a lovely, awesome thing, and please, everybody color, and the recognition that we shouldn't stop enjoying the grounding feeling, the intrinsic, wonderful feelings we get from coloring and relaxation at any age. Yay. I'm glad society agrees. And there's lots of fun coloring books out there now. That isn't art therapy, it's therapeutic art, because art therapy is effective because since the beginning of time, art has been a healing component of society. So therapeutic art includes arts and crafts, hobbies. It is a fun distraction. We all need that sometimes. I'm always teaching people that some level of compartmentalization is healthy and necessary. And similarly, distracting from our pain is important at times. And just, it involves like learning new artistic techniques. That being said, I have a lot of art therapists, friends, or professors who would talk about the value of teaching a client how to do an art task, the power of that. Or later on, I talk about the power of learning an artistic task alongside a client. Like if neither one of you, for instance, I don't know how to knit or crochet, and I have a client where we're going in that journey together, the power of that and who's helping who and what's the best way we should learn, and we're doing this together. So it's not that it's not a place for any sort of teaching and learning, but it's not usually the emphasis, because again, when our client's entering a space to have therapy, to heal, we're using these art materials as a tool and focused on the process. And then all of these can be soothing and emotionally beneficial. So this isn't to compare which is better or worse. It's again just to help define what is the difference, what's the big deal, why are we talking about this? Art is art. There are risks involved. I'm going to just really pound the definition for you. But art as therapy is an activity that can evoke feelings of satisfaction and achievement through the act of creation. Art therapy is evidence-based. So there's research background around the why it works, which I'll share with you. It uses techniques from art as therapy while focusing on self-reflection and navigating emotional challenges. So another way to view it is art therapy takes it a step further. You're not just playing with the materials, you're then processing, allowing your client to share in a therapeutic space by not jumping to just the we're having fun assumption. Like any form of therapy, the relationship is crucial. So at the end of the day, it's about connection with the person in front of you. It always has been. No modality works without that connection and safety. And material choice is something we'll delve into about. That's a way that you're maintaining that relationship, is when you think about how do I keep my clients safe in this setting. I have a fun tidbit that I'll share of when I made that mistake of not thinking through that, of how do I keep my clients safe. Art materials and directives are part of the relationship. So it's all connected to the relationship between client and therapist. So there needs to be that relationship specifically for it to be true art therapy. It's with an art therapist. I'm not trying to beat a horse over it. So one of my favorite things is that there is no way to pinpoint when art therapy began because it's always been around. Humankind has always been using drawings, dancing, storytelling, making aesthetically pleasing objects. So it's not to say beauty doesn't matter, but since before we even tried to capture our history as humans, it's been used. It's deeply linked to spiritual and therapeutic uses. And today, in modern day, we have created boundaries between art, medicine, and religion and sort of define them as separate, even to where people don't acknowledge the overlap. And the reality is, for many cultures, both ancient and current, those distinctions are blurred to non-existence because they're so intersected, so woven together. Art, medicine, religion, like all in the quest of healing should be used together, but we like to define and put things in boxes as humans. So art therapy as a formally structured medical practice began in the mid-1900s. Adrian Hill, British artist, was believed to have coined the phrase. Just a fun fact for your trivia night. But early use occurred for patients of tuberculosis. During the time they locked infected patients away, and they were a combination of like a modern quarantine and inpatient hospital. And art therapy is still really used regularly with tuberculosis cases. They're not treated in the same like structural sense, but art therapy is still used. They noticed that tuberculosis patients who express themselves through drawing and painting seem to suffer less. So it was kind of the first like, these individuals are doing better emotionally by doing, what's the difference between these folks and the ones who are not making art? So by engaging in that process, they were expressing themselves, they experienced a level of freedom, and they didn't feel so alone. They were able to connect with something bigger than that space they were really trapped in. I gotta include my girl Margaret. I'm a Margaret, so partly why, but also she came up a lot in grad school as she's really instrumental in bringing art therapy to America. And her work was deeply psychological and focused on the unconscious and subconscious. So she was a little ahead of her time with viewing the brain and how art was impacting the brain. And Edith Kramer is another important name. I'm gonna jump to a video that kind of says some of the things I've said, but they have nice Australian accents and you can hear it from someone else. Everyone hear it okay? Is it showing for you?
Hello, my name is Louis.
No, it's not showing the video, but we can hear it.
Okay. I'll switch my sharing. Stop share. Now, can you see the
Yes, ma'am. There it goes. Appreciate
gal? Okay. Thank you.
Liotta, and I'm an art therapist. Art therapy uses a variety of art materials and gives you a way to express yourself, not just through words, but through art making. Art therapy is more about the process than the quality of the end product. So it doesn't need to be aesthetically beautiful. It's more about what you get out of it and the meaning you make of the art in the session.
Art, as you know, is a non-verbal process. People have been using it for centuries. The ritual of creating a piece of art embodies the person themselves, the direct result.
Peggy, actually, we can't see the video. We could hear it, but there's nothing happening with the video.
I wonder why.
Is projected onto the paper. Once they've created an image, as an art therapist,
Maybe if I don't do it full screen, let me try that. Can you see my whole screen then?
Yes.
divine to
We'll
talk
just be
about
smaller.
what they've created. If they can, if they don't talk about it, the therapy still works because it's such a deep unconscious process.
So one of the great things about art and using it therapeutically is that it can be done at home as well. You can use a journal to record how you're feeling and thinking via art. It's a great self-help tool.
Art therapy began being used in health settings after 2 devastating world wars in the 20th century. This resulted in many soldiers and civilians having difficulties readjusting to life in peacetime. New approaches to treating mental illness, including art therapy and group therapy, were developed in the UK and USA in increasingly overstretched mental health facilities used to treat returning soldiers with post-traumatic stress disorder. This then began to expand to other areas of mental health.
A variety of age ranges really can attend art therapy. It can be from a very young age right through to the elderly, and they may have a mental health issue. They may just be someone who's struggling with an issue at the moment, who wants to understand themselves better and understand why things have happened to them in the past or in the present. It offers often young people, especially who don't have the cognitive capacity to necessarily talk about what they're doing, to find a way to express themselves through art.
So art therapy can be a bit of a hook into having that young person open up and feel more comfortable and relaxed. And it also allows them to express themselves in a narrative that's very different to the traditional medical interview around mental health. It allows them to integrate their story in a way that has more humanity to it.
Someone who's an adult and hasn't used art materials for a long time, you might start really simply with them, and even using collage, so actually using magazine images, things that they can tear, so showing them that it doesn't have to be perfect, they don't just have to cut it out, and then they can explore lots of different materials.
We've used pastels, we've had paints, we've had clay, paper mache, we've made puppets, we've had young people sew objects that are precious to them. Yes, we've had so many different artistic expressions going on in that space.
So it is therapy and not just art making. We actually have a triangular relationship where there is the relationship between the therapist and the client, but also the art material. And at certain points, there can be more emphasis on the art. There can be more emphasis on the relationship. It can go in different directions. Ultimately, we want people to build an understanding of themselves, to work through difficult experiences in their life, to gain insight, and to hopefully repair some of the ruptures from either their current lives or their past experience.
Art therapy is an important field of study in the Masters of Mental Health. It's a particularly interesting field of study because it relies on non-verbal, expressive ways of accessing processes that assist people to resolve and deal with their problems.
Master of Mental Health in Art Therapy at the University of Queensland offers...
And it goes into a commercial to go there. So if anyone wants to go to Queensland, let me go back to the slideshow. And I don't know if they said this, but if anyone has questions at any point, you can put those in the chat and then we will make sure we get to them. And I'm really curious how I do with the timing of today. My break lands where I was hoping it was. Is this full screen for you of the slideshow?
Not yet. You might have to do what you did last time where you, for some reason, putting it into full screen after you share your screen isn't working.
So you see this. How are we doing now?
Still on like where you would edit slides.
What did I do last time? Close this. Tech savvy ways. You can edit this out of the recording, right?
I might be able to.
Just kidding.
We'll see. Is there a way to try to make it like full screen first and then share the screen?
And I can't see the.
Like go into presenter view. Oh, um, it's mostly in presenter. We can see like the little tabs up there, but it's like in a actual presenter view versus how it was before.
Okay, so just ignore my tabs. I don't have anything embarrassing up there. So the science piece is so fascinating because obviously our understanding of the brain is always evolving, but recognizing that the art and understanding why the art works, I think helps us have a respect for not the fragility but the risk of, we never want to cause harm. That's the name of the game. And I don't believe anyone would intentionally do that, but knowing what's happening in the brain can help us to make really better quality choices around incorporating art and talking about the art. So it promotes that bilateral brain integration. Again, science, but the right hemisphere stimulated promotes through the sensory art experiential, while the left hemisphere is activated through the verbal. So rarely is a client going to be silent the whole session. They're naturally going to want to make those connections and speak about what they're making, or sometimes you're just chit-chatting while you create. Other times it's more, hey, we work for a while and then, hey, we've got 10 minutes left. Let's take some time to share what you would like to share about your image, giving them that power to describe what they like and how much. If a client doesn't want to talk about it at all, the one thing I do usually ask is, of course, I respect that they don't want to speak about it and they don't need to, again, for that to be healing. But I do encourage them to try to come up with a title of it. So if you were to name this piece, what would you call it? And it just helps them connect both sides of that brain there, integrate. Because what we're all trying to do in therapy is rewire these typically unsettling memories and relationships in the brain to those memories and people's sense of safety, self-worth, their ability to create and hold a boundary without feeling anxious or guilty. So we're engaging the brain's neuroplasticity when making art, and it helps people recover from those traumatic events, both physically and emotionally, because you're creating new pathways. There is increasing evidence that neuroscience and art enhance brain function, that it impacts brainwave patterns, emotions, the nervous system. We know, of course, that coloring or creating can be calming. It can also be dysregulating, which we'll get into more later. It can raise our serotonin levels. Yay, that's what we're all always trying to do. And the benefits can also occur by experiencing the art. So viewing art can stimulate the creation of new neural pathways and ways of thinking. This, I think, could be really life-changing for clinicians who don't want to make art themselves, or you have clients that have no desire to get messy in that room. You can simply view images and be activating those parts of the brain and have clients share their response, their feelings, even point out which ones they're drawn to, what comes up for them, that enhances your toolbox of interventions, that you're incorporating other ways of healing, connection, communication, building rapport in new ways by using imagery and artwork and sparking thoughts and conversation that way. So in one study, so you guys can see us over here too. Can you see the people on the right-hand side?
Yes.
No, I was gonna say I don't see anything over there.
Yeah. Well, don't do anything embarrassing, Courtney or Bianca, because we can see you. Don't pick your notes. So in a study conducted by a professor who's obviously well educated, but participants underwent brain scans while being shown images of paintings by artists. The study found that when people viewed the art they thought was most beautiful, the blood flow increased as much as 10%, the equivalent to looking at a loved one. Which, when I was creating this, I was kind of chuckling, thinking putting images of a loved one might not bring that same feeling for some. A lot of times people are coming to therapy to work through things with loved ones, but that idea that artwork can be flowing blood in our brain to help healing, I don't know that we often think of it that way, of viewing imagery being physically healing. Art accesses many of the advanced processes of the human brain, like intuitive analysis, expressivity, embodied cognition. And artists are often better observers and have better memory, and maybe due to how art affects the brain's plasticity. I'm sure we could argue there's a lot of artists with substance from the past, substance use. So that was interesting too, that to say that artists often have better memory. It was like, but better observers, I can get behind that because they're constantly viewing the world as art. So we do not own art. And as I said earlier, I can't speak for every art therapist or artist, but I kind of feel like I can with this, that everyone should be utilizing the creative parts of their self to heal. And so why does it matter how it works, or if we aren't informed, if art therapists are even saying, yeah, everybody make art? I have never, can truly say never, gotten in the way or discouraged a clinician that I supervise from incorporating art activities or art projects with their client if that feels like a way to tap into their healing. I talk through the nuances of incorporating that intervention or activity, but it would be counterintuitive to discourage anyone from making art and using materials. So here's my story I was going to tell of. It was just only, I think it was 2 years ago, I was going into the schools to lead groups with the, it's equivalent of a therapeutic day school, but it's through the public school. So these are kids who have severe depression, a lot of truancy or school refusal, all different ages, different sections. I've been doing this so long, whatever, I'll just order some new materials and just see what happens way. I ordered these inks, and we were going to do this like a straw blowing, and then I got like coffee filters where they could make butterflies. Like I was thinking we're going to ink it up. It's going to be great. I didn't plan a specific activity because I was kind of going more open studio, which isn't the end of the world, but when I tell you how it went, I didn't have anything like pre-set up of like, here's your station, here's your material that you're going to use. And I guess most importantly, I didn't like practice with the material myself and get familiar with it at all. And so I got out the inks and we went for it, and it was very messy, and not like I'm a crabby mom and you always mess up the house, because I am that, but oh boy, everyone's very dysregulated, and I'm feeling some panic of we are getting ink literally on the wall of the school on accident, like not washable ink. I didn't think rhymes. And it was such a humbling reminder of like, whoa, I need to think about who I'm working with. Some of these kids can, of course, handle like the freedom and the fluidity literally of, yep, I can figure out what I want to make. I can use this. I can play with a new material and feel safe and secure in that. A lot of those kiddos could not handle that framework in that moment of that level of a dysregulating material where you don't have much control over it. Total lack of like structuring the activity. People were physically safe, and they knew the general layout of having the group with me, and there were adults present, so nobody's was at risk safety wise physically, but the chaos wasn't beneficial. It wasn't then, oh, let's process what happened, let's bring this back together, and how did that feel and how did we handle it. It wasn't therapeutic because I wasn't considering the material choice. I was just thinking, what else could we try, what haven't we done? And it was a rookie mistake and very messy, and I had to call janitor to help clean up the wall and came back weeks later with a magic eraser, which really are magic. But the inks always remind me of the day I was reminded that it really does matter, because I did a disservice to those kids that day. And again, no one was truly harmed, but it's not a good feeling when the instructor, the therapist, is also sort of out of sorts and not able to provide that sense of calm and I can handle this and be safe with you in this. I was a little flustered, we'll call it. So that brings me to those ethical considerations. So what can happen if we don't? And for one, don't call yourself an art therapist or describe your intervention as art therapy without the training. I doubt anyone here has this like on their website as like, I'm an art therapist, and just like hoping you don't get caught with fake credentials. But I advise my supervisees when they use art in session and they're writing their note to indicate that as therapist employed art making and creative expression to encourage client to blah, 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 to the process, to build rapport, to explore themes, to depict a specific feeling. So it's subtle. It seems not the end of the world. We're not losing sleep over it, but it is important. And I'll get into that a little bit of like, how are you presenting yourself professionally? For instance, I don't call myself a play therapist. I have minimal, obviously I play games with kids at times. We do playful things. The art materials are sometimes then morph into a play experience. And that's not my specific area of expertise or something that I have certification in or enough training in to call myself a play therapist. Whenever you're like not sure, or if you're looking for an idea, the best practice is always to ask someone, to seek information, to consult someone, to shoot an art therapist an email. Most people are friendly who are in the helping field and want to be helping people do the best work. So seeking information from an art therapist if you're curious or if you're concerned about a particular case. So I'm not saying anytime your client's very creative and wants to use art and you don't feel quite sure to say, I can't be your therapist. That's not the message either. It's get information from someone who has that background to help keep you in, I was going to say keep you in your lane, but it's a wide lane. We share a lot of lanes. Because they're not going to say, don't make art. They're going to give suggestions for how to help that client feel safe emotionally. They're going to say, don't bring ink without a plan and just hand it to kids and hope for the best. If someone were to claim to be an art therapist without possessing the proper qualifications or licensing, they could face ethical consequences. It's deception. You're claiming to be something you're not. It's fundamentally dishonest and violates ethical principles. I've seen there's a whole series of someone on YouTube who is very out loud that she's not an art therapist, but she's doing videos about being artistic, and she's great, and she's acknowledging like, this is what I am, this is what I'm not, but I can tell she's very careful about not pretending that she's a licensed art therapist, but it doesn't mean she's not doing healing stuff. She's just covering her butt. The biggest piece is we don't want to unintentionally harm our clients by using something that we assume is harmless or helpful and not thinking through the possibilities. So practicing art therapy without adequate training can lead to the harm, especially for vulnerable populations, or I would go as far to say as traumatized, and the percentage of people that walk in the door who have some type of trauma is high for most of us. So misinterpreting or suggesting false meanings in a client artwork, first of all, it could just like offend a kid if they're like, that's not what I made, but it can lead to miscommunication and potentially inserting false memories. So that can rupture relationships instead of staying in a place of truth, undermining client autonomy. So you're hindering your client's ability to find their own insight through the creative process. Again, not usually intentionally. It's, oh, that's really pretty, that thing you made. And they're drawing a butterfly about the time they were abused, and you're calling it pretty. It's not on purpose, but the words that we use can interrupt the client being able to name their own feelings or process or form connections or new pathways of their own memories and creations or observations. Engaging in practice beyond one's scope of competence. So it could be just inadequate treatment or exacerbating existing problems. That includes to just not taking it to a place of deeper healing if you stop short at the beauty of it. So it's, again, not all bad. If your client's really excited that you're complimenting their work, that's great. It limits that next phase. So if I ask a client more neutrally, what do you notice about this scene with the butterfly? Allowing them to be the one to tell me what they notice, or if they really want my input, I will say what I noticed. Like, oh, I noticed that the butterfly's over here. What's going on over here is different than that pink you used is so pretty, and that butterfly looks really happy. Like I'm jumping to these conclusions or possibilities that may or may not be true. Is she harmed in that? I don't, the imaginary client is she? Not necessarily, no, but we limited where the healing could go or where the conversation could go by being, it's like a reflex. Like, how are you doing? Good. But you're good. Have you ever seen that meme where it's the therapist? There's like two how are you? How are you really? So artwork's sort of similar, like, oh, here's what we see, but what do you really see? So it doesn't always take it further if you don't come in with that lens of my favorite thing I learned from Brainspotting is WAIT, WAIT, and it stands for why am I talking? I needed that from like grade school on because I always got needs improvement for practice of self-control because silence is hard and we fill it to comfort others. But Brainspotting really taught me that, and in grad school, it was like an area I worked on of just tolerating silence. And art making can be similar. You're not insulting them by not jumping to a response or a compliment. So WAIT, why am I talking? Asking yourself that of like, is this for my comfort? Is this because it's too quiet? Is this because I want them to tell me what they're making and I'm just curious and want to know right now? Or is this the right time to say the thing that feels therapeutically helpful in this moment? Just slowing down is important. We could do harm because of our own implicit bias. We could misunderstand or assume cultural symbolism or just assumptions in general. So it's fascinating if you research kind of color theory across cultures and what colors mean, what symbols mean. But if you're not informed of your client's background and what those symbols mean to them, and you just observe your own implication of, oh, those look like the McDonald's arches, and that's not at all where their mind was going. Again, is it harmful? Maybe not, but is it helpful? Probably not in that setting. It's not the same as just an art making space that's very neutral. You really want your client to be able to lead the space in every way. The other thing that comes up a lot is when a client's hard on themselves about an artwork or saying they hate it or it's ugly or I don't like how it turned out. Trying not to jump to a place of comfort and band-aid but I really like this and what about this, where we want to swoop in naturally and make someone feel better, really allowing them to feel what they feel and decide for themselves what happens next. Are you going to destroy this piece? Are you going to work through it? Are you going to rip it up and turn it into a collage? Or are we just going to stop? And that's your decision to stop making art right now and just sit with what happened. The reflex, particularly for non-art therapists, would be to potentially try to smooth it over and point out something that is positive about the artwork. It's okay for the artwork to not turn out how they wanted initially. You could do damage to our profession, but so misrepresentation can damage the reputation and public trust of the art therapy field. So if someone's calling themselves an art therapist and doing their thing and not trained, that's not a good look for the field itself. It makes it harder for qualified therapists to gain recognition or get roles that maybe someone else had and didn't perform as well as a trainer therapist could have, or someone that has more background in those considerations ethically. The loss of credentials, if individual holds other professional credentials, they may face disciplinary action. These are extreme, obviously. And again, my takeaway today is not like, don't touch the art, but just things to understand why. Legal ramification, depending on the jurisdiction or kind of what happened. So when I read something legally unfolding or disciplinary action by a licensing board, my mind goes to working with someone with severe trauma, not being equipped to handle what could occur when making artwork, with someone perhaps who dissociates or self-harms or gets very dysregulated or a psychotic episode, not taking into consideration safety with the art and assuming that the art will just always be healing and positive and that leading to something safety-wise occurring. That's where my mind goes legally, as well as anytime there's a contentious divorce situation, it always feels like somebody can get fired up about something we do that we shouldn't be doing or don't do well. So the scrutiny of involving art therapy, if you don't have those credentials and you're saying you're doing that, you just never know. If you want to read more of those detailed ethical pieces, I did include those links to art therapy associations. But what does it look like in practice? So it's painting, collage, clay, drawing, anything really. I really love using nature as a way of, as an art medium. Just having clients build a sculpture that's temporary and left in nature is really powerful, or gathering materials from nature, either outside the office or at home or at equine barns, and bringing them to session and creating. So it doesn't have to be expensive or intimidating. But we're about at 10, so this might be a good time to take the break and then jump in. So what you'll do is grab your own materials. Hopefully you have something nearby. It doesn't have to be fancy or involve messiness. After the break, this is the slide I made this morning. You're going to either go to the bathroom, have coffee, eat a burger, or stretch. But after the break, we'll come back and we will divide into small groups. They'll create breakout rooms. Courtney is going to help me because you saw my tech skills. And yeah, we'll talk when we get back. So do you want to say 10? So 9:54? Okay.
Yep, 10 sounds good.
Go
Thank
start
you.
a burger.
Questions? And would you like me to just keep track and ask them at the end?
Yeah, let's wait, just in case they get answered naturally or evolve. We'll just do them all at the end.
Okay, great. Thanks.
Welcome back. So, in case I wasn't clear about this, art making can be directive. Create an image of your sadness, of a flag that represents your family, design your ideal house, draw an animal that makes you feel safe, really a number of things. Could also be more open or non-directive. So let's create or color while we talk, while we listen to music, or in silence. So the second one is probably one that people have done where like, yeah, let's just get out materials and you can color, almost how we treat fidgets sometimes, of like, this is going to help calm you and help you relax. Obviously those approaches have an impact on how the session plays out. So we're going to break you out into small groups. I'm going to assign the leader. I decided by whose name, your name that you go by day to day, not your legal name, is the closest to the end of the alphabet. So that's going to be the leader of the group. If you have to go to the second letter of your name, do that. But just so that it's not an uncomfortable battle over who has to lead. But the leader of the group is going to decide which directive your group does, and kind of be the facilitator of, we're doing an art therapy group today virtually, which is just as therapeutic as in person, but a little different vibe. We're going to spend about 15 minutes making art, and then 5 minutes talking through it. So I'm going to just give a little cushion. We'll say we'll come back at 10:25. So you can do 10 minutes of art, 5-10 minutes of talking, however you want to structure that, because you're the leader now. But can you leave these up so that the leaders can choose or put this in the chat maybe, of the topic options. So whoever is the latest in the alphabet with their first letter of their name, their first name, nickname they go by, you're going to pick what your group works on. And you don't have to overthink it. It's an experience for a reason, and then we'll come back and kind of see how it went. So I think it'll be about groups of 6, and one person will be the leader, picking the topic, and be the one chalking the time a little bit to make sure you give time to share what you made with each other. Hopefully the technology cooperated. I know the questions maybe weren't visible, and then we sent them through. So I also have attended many a training in my day and don't want to force anyone to chat or show your face. It's okay. But even in the chat box, I want to start by just asking the group members, how was the experience? You're obviously welcome to unmute or raise your hand and share your ideas, but I'm not going to pull teeth if you don't want to. But what surprised you about what you created, or any of these answers that you want to give. And we're going to be a little, not critical, but honest about the facilitator. So were there things that you would have done differently if you were the facilitator? And what did you need from the materials, the facilitator, the space to feel safe? So do we want to read people's input, or does anyone want to share their ideas about how it went for them as a group member making the art?
I don't mind sharing.
Yay.
How's
Hi.
everybody doing today? I appreciate this facilitation. It is very eye-opening and
Oh,
it is
good.
very warming to be a part of. Well, we had a phenomenal facilitator, PZ. That's how I remember her initials because she was chosen by her initials.
Okay. Love it.
But PZ was chosen, and we all decided to draw ourselves as an animal. And I thought that it was very unique that once we started sharing that a comment was made that I felt shame. I kind of felt, almost like embarrassed of my art because I'm not as strong in art. And it's very interesting how her observation of what the art, like just drawing brought out of her. And it kind of resonated with me later because we start with that blank canvas. I have to create something blank out of anything, but then looking at yourself, considering what do you find uh unique or that stands out for yourself. And I thought that was unique because she said, I was shameful or kind of almost embarrassed of the art. But once I put a face to it, once I started to make it me, like, oh, this signature, then it lit up. Now the shame is gone. Now that, kind of that darkness kind of weathers away. And I thought it was unique that me and one of our other colleagues drew us as cats. So we drew cats. I drew myself as like a cool cat who does community street outreach work. And I'm providing
Thank you
these,
for sharing.
no problem. And I'm providing these tools to be able to assist anyone who has been damaged, who don't feel that they see the value within themselves or want to be involved just in societal, activities. Sometimes we don't realize that unique difference isn't to isolate us for protecting ourselves. We're isolating ourselves because we are trying to figure it out. And having these spaces to be able to express it, having these spaces to be able to see that there are common things that we share amongst our peers that we may not even speak to them. I think it was dope. She said, I drew a cat across the street, and the cat in my house, I feel like that's his friend now because they may communicate.
You make
And I'm
cat
like,
friends.
yes, 100%. We have some of those people we may drive past in traffic and just give them a peace sign or a head nod, and that just companionship them along with each other, let us know that we all are present, we all are here, and to be seen and
Another
heard.
thing you're talking about too is the like bravery of participating, of creating,
Yes.
facing the blank canvas that we take for granted sometimes when we put art materials out, of like, we're asking a big thing to like be vulnerable or do something new. And especially they say for an artist or anyone that a blank canvas is the scariest thing versus a like, here's a worksheet to fill in. Or so if you have a client who's really, you're building that relationship with, you could also start with something on there and you're going to add to it. So like all these little things to consider about helping someone feel safe. I also know we could talk about, I would love to see like everyone's art and talk about this piece forever. So yeah, anyone else want to share what they noticed or felt or what surprised them? Thank you, Jamario, for being the brave voice of the group to start. And
No
we don't
problem.
even necessarily have to talk about it, but just things to think about, like, okay, so if that was me, and I know like one of the breakout rooms ended up just being 2 people. And so the curiosity I feel about like how'd that play out, just kind of the expectation to roll with it, or I guess it's going to be a little more intimate experience now and that we can't always plan. But I appreciate those of you that were willing to engage and show up vulnerably, even if it was for 10 minutes. The decision for which directive to use is interesting. Like you could let your client choose, you could choose, but you all probably don't know each other or just met. And so intentionally, I put one in there that had to do with embarrassment and really naming that, because you just met. Is someone going to choose? Does anyone choose embarrassing situation? And sort of put people on the spot in that way of, you're not going to just meet your client and say, show me your trauma, draw me your abandonment of your dad. That we don't jump right there. You build that trust first and that sense of safety. And maybe a client comes in ready to do that, but we think about those things before our own detective curiosity therapist self assumes that they're ready for that. So with most interventions or approaches, we're wanting the client to feel in control and safe and get to lead, like exposure therapy, brain spotting. You're riding the tail of where they're bringing you. Facilitators, does anyone want to share, or were there any chat things from the group? I lost my chat thing. Courtney or Bianca, can you
Actually, can I ask a question?
I love questions. Sure.
I'm very curious if anybody if any groups picked anything other than the draw yourself as an animal, because I think all three of the other choices really required a level of vulnerability regardless. So I'm just kind of curious if anybody did.
My group actually picked the folding the paper in half
Cool.
and doing the images for the past and for the future.
Cool.
Yeah. My group picked the first one, use colors and lines to show your current feelings. So we all were very much in our current feelings, but it was good and receptive.
Yeah, that's like a beautiful way to start with art making. Like you really encourage the client, you don't have to make any recognizable shape. You're just choosing colors and lines. I was talking with Courtney and Bianca about someone who's very particular about like, I'm gonna feel like I fail if it doesn't look how I want it to look. You can start by saying, we're gonna use our non-dominant hand and close our eyes, or we're gonna close our eyes for a minute, do scribbles, open your eyes, what do you see? So like really just engaging the brain and creativity without the pressure of it needs to look, I mean, you're not gonna start with a self-portrait or someone that, and oftentimes the clinician doesn't feel or identify as an artist. So something that feels non-intimidating. But yeah, thank you for asking that, because it is interesting to think of what was chosen. And as a clinician, what was your reason for choosing that? Did you poll the group? Did you say like, I just want to hear people give me the scoop? Like, what's your dark secret? But or which one seemed fun or light? So that is interesting. We're all professionals and aware we're in a training, and so there's a little more freedom to just pick something maybe that was scarier. But for our clients, and even thinking maybe this is their first therapy experience ever, or they've been in therapy years and years and years and feel like nothing's working, you're trying to activate other parts of them.
I have a question.
Yes.
In a session with a client, do you ever like you gave us 4 choices? Do you give choices, like of activities or materials?
Yeah, I really want them to feel like they can choose. So I've given like a menu almost like that before. That's a great way in groups when you're going to have a big mixture of like what people want to do. Give the menu of choose what you want to do. Most clients from the jump, if like they love art and they're creative and they just have an idea and want to run with it. But I will usually give options no matter what, of here's what I was thinking we could do today, or you can create whatever comes to mind or what speaks to you. There's always that caveat of, or you can make whatever you want, because my therapeutic agenda might be healing, but if they have something else that needs to get out of them, that's priority for me. And then the materials is really, whatever they see and find. If there's constraints of like, I don't have a kiln, there's like limitations to materials to some extent. Or a good example is a colleague had made like sensory bottles with a client. We were out of the oil. Okay, we don't have the oil, but like what else can we use, or what else would sort of fit what your mind was in the mood to make today? So we kind of just roll with what's around us. But for someone that I'm introducing our therapy to, we'll get to this about the spectrum of materials, considering the safety feeling of, oh, hi, sensory bottles.
We literally just made some for one of our students. I love that you said
cool. Well, one time we got crazy with flour, and then I put it in a bag and didn't think about what happens to flour mixed with things. So don't do that. If you learn nothing today, don't just put wet flour in a bag and hope you don't stink up the whole place. The question, I'll get to the spectrum of materials, and that will cover a little bit of what you asked as well. But the facilitator, did you choose to create with your team, is something I'm really curious about, because that's a question that comes up a lot for art therapists and non-art therapists of, well, should I make with them? Sometimes personally, I almost play down my artistic ability to not intimidate them. But I usually make alongside them to like, I'm in this with you. I'll do something, I'll color while you're creating your thing. I'll model that bravery of show me your path, draw me a tree. But I don't want to make them feel worse by being like, look at what I can do, no biggie. Or sometimes I make the artwork of them or about them and then gift it to them. So there's not like hard, fast rules about how to do any of this. You're just really being mindful and not just leaning into the joy of art materials, assuming there aren't these nuances. But did any of the facilitators choose to create, or intentionally like, nope, I don't have to do this, I'm just gonna sit back?
I participated. For me, I think with any training or activity, if I can do the activity, that's what I'm going to take home with me, because that's what I'll remember. First, I was panicking. I was like, oh man, we have to do this activity, but that's what you're going to remember and take home with you, you know, or take to your practice. And so I really appreciate that. We did pick
that parallels therapy, because that's the creation is what you're going to take with you. So if
yes,
we're sitting and just talking.
Yeah, and kind of thinking of like, well, you know, we recommend people seek their own therapy if you're going to do therapy. And it's like, how are you going to do an activity if you haven't done it yourself, I guess, right?
Yeah.
We did share our artwork, and I lead a team of clinicians, and I thought it was funny that I was the one that ended up having to lead the
back at work.
and I'm just like, okay, this is natural for me. But I thought it was awesome.
Now with your clinicians, you'll have to do some art. I'm gonna go quickly because there's a really great video I want to get to at the end. In hindsight, we could have done the activity to start and then done the dry learning, but some do's and don'ts that I want people to take home with them. So we talked about material choice, displaying and storing client artwork. I feel really strongly about that permission, not only legally to get consent, but one of the things in our handbook that I have in there is leaving artwork out. Most kids especially are like, no big deal. At school, I leave it out too, or it's drying, I'm going to finish it next time. But what that subconsciously tells the next person who walks in around is what they share and hear safe, and no one else is going to see it, really sticks with me, of the message you want to relay around this is between us. Sometimes they want people to see their work, of course, but there are those instances where this is really heavy and scary, and I don't want someone to see this or come upon it. Even if there's not identifying information on there, the idea that someone can see that extension of them without them knowing who might. And so, of course, art decorates the walls. Some kids are like, I made this for you, here you go. But being mindful of, are you okay if we leave this here? Or we have multiple drying racks and shelves and trunks where I can tuck things away so they're not seen. We talked about speaking about the client art some, and then we're going to get to some other activities to take home with you to bring into your practice. So clients are directly impacted by the level of control they have over the material. I would love to delve into what material did you have by your computer for today? What do you already own, or what did you feel like you would want to, how much did you want to let loose material wise today? There's a interesting clip from a movie about chaos versus control. I'm not going to play it because it's really just about the artist who, this painting is from the same painting. And so it flips back and forth. On one side, it's more chaotic. On one, it's more controlled. And so within ourselves, we can create imagery that has more or less control. What I'm most interested in as the clinician, are you presenting them with a material or giving them choices of materials where they're going to feel that sense of safety? I don't know how triggering those top images are for all of you, but they bring up a feeling in me. Love a mess of wet clay, glitter. Yes, I am an art therapist. We have fun, we make art, and I am too feel the textural impact of not feeling a sense of control over something. So clay is notoriously one that can be triggering for clients who have a trauma history and are working on a project and feeling that physical, sensory, intimate loss of control. It doesn't mean don't do clay with someone who has that background, but remembering that messes can be dysregulating. And so what the next step of that is, before you think about it and give the option, is you're thinking, all right, we're going to make sure that we leave enough time at the end to bring it back, ground this individual, help them be back in their own body. I'm sorry. So considering the impact of giving options versus a directive, The feeling of overwhelm you had asked about, do I give choices? I absolutely give choices, because also an open studio concept, or make whatever you want, it's very scary for some and overwhelming. So to not have any path option, or like that feeling of, am I doing this wrong? You may reach a point where they're like, hey, I want to do this today. Like, now I kind of know what to expect. But early on, introducing them to using creativity as part of their healing, giving choices helps them feel that sense of structure and safety, and not feeling like the pressure's on them to do it right or well with a blank image, or no topic or anything. Clients with a trauma history may benefit from starting with projects that feel structured and safe, and as you're building that relationship, and then practice with a medium before you introduce it. Because they don't want to feel your own reaction of, oh boy, this got out of hand. Like, I have a client who, she makes a mess every time, and I have to recognize my own nonverbal reaction and response in my body, because it impacts her sense of like, am I allowed to do this? Are you accepting me as me? Can you handle me? So I really kind of think of it as like pen to pencil all the way to glitter, of how much control you have. Pen might actually not be it, because you can't erase. So a mechanical pencil perhaps is the most control, because you can erase what you did pretty easily. Trying a new medium alongside your client can be powerful. Like I mentioned, your client can teach you things, which we know how powerful that is, and gives them reins in their life of like, I know some things. I am the expert. You don't have to be competent or feel like an expert with a medium to explore it with your client. But being mindful of not speaking negatively about yourself. Courtney, I'm going to call you out. She said, I'm not very creative. How often we say like, I'm not an artsy person. I'm not creative. We're all artsy if we let ourselves be. We all have an artistic side, a part of our brain that lights up with expression. Our mediums might be very different. You might be able to like arrange your food on a plate really pretty, or create masterpieces with your landscaping. Like, it doesn't always fit the box of what we consider art in an art therapy setting, but being mindful of speaking negatively about yourself to help make your client feel better is another bad habit for all of us. Be prepared to help your client ground themselves. So that's another huge takeaway, is allow time for cleanup, time for grounding, for taking deep breaths, for whatever sort of rituals you have as a clinician to like honor what was shared and made, but bring them back to the room. Because one of the worst things we can do is really dysregulate them and send them on their way. So we made this big mess. You talked about your trauma. Whether you meant to or not, you processed something difficult from your past. Maybe we didn't even talk about it, but now it's fresh on the surface, and we were in a rush and we cleaned up and okay, bye. And that's not fair to our clients. It doesn't mean something terrible is going to happen, but we're not doing our best by our client to not contain some of that high emotion. Displaying client artwork, I won't read this in depth, but get consent. Like maybe your practice is having an art show and you're really leaning into like, we want to utilize client art. Have consents filled out. Confidentiality is paramount. Like I said, the artwork is an extension of them. Considering all of the ethics, their right to be informed. So you can't just like take a picture of it and use it without their consent. Even if you know my client would love to be on our brochure, get that written consent, and think about the context of like, oh, we're going to put this in the waiting room, and this was a pretty traumatic piece. Just being thoughtful about those things. Storing, I talked about this, so just not leaving it out. A really, really important component is how quickly artwork can pile up around the office if you're making things and it's drying. And so best practice is them making a decision in that moment when they make it. Do I want to take this home? Do I want to destroy it? Did I truly make this for you? Or am I just saying, oh, it's for you because I don't know what to do with it and what it means to keep that piece of theirs. Something we do commonly is take an image of the artwork and upload it to their chart if it therapeutically feels relevant and helpful to refer to it later. So I like to have an early art piece, and then when I'm near discharge with a client or termination, then saying, let's look back at this. Do you remember making that? Like, what if you made an image on that theme today and we saw visually your growth? So using art as a tool to show growth and progress. But it's usually, the rule of thumb around here is like, it can dry and stay for 1 week, but the amount of times I think there's no way this client's going to disappear, and then months go by and we haven't scheduled because life got crazy, and now I've got this really meaningful thing they spent a lot of time on. Do I mail it to them? Do I reach out to them? Like, what do I do with this piece of them? And clinically, I mean, we're obligated to keep client records for 7 years. Applying that to the art is probably best practice. Photographing it and putting it in their chart is one way, but it just feels very icky to throw away someone's artwork. So trying to get them to decide in that moment where that artwork's meant to be. So avoid making assumptions about what you see. We talked about that. The phrase is like, I like that. You're pretty, you did a good job. Someone in the chat talked about like, always makes me think of gift acceptance, of like, if your client made something for you and you're like, I can't take gifts. Of course, we're considering cost and cultural background and the significance of what that gift is. Art is similar in like how you're speaking about it. You're kind of reading from your client, like, I'm not going to insult. So what I often do is like, if someone directly asks me, like, do you think this looks pretty or do you like this? I might say like, I really enjoy looking at your artwork. What do you like about it? Or how do you feel? You're just like anything in therapy, bring it right back to them. If they're trying to make it about your feelings or opinion, I'm not going to critique them or be critical. I'm going to challenge them about, why does it feel important? Or what would happen if I didn't want to hang it in my house? Like, you can challenge that concept too of approval and use that therapeutically of, I noticed you're really hard on yourself while you're creating artwork. Is that something that happens day to day in other scenarios too? Do ask open-ended questions, share observations in a neutral way. This was in the chat too, around like, you're just saying what you observe. This is similar to equine therapy too. Like, we're not judging what's happening. We're just saying like, oh, I noticed an energy shift when you were talking about your sister. Did you see the horses like over there, what they were doing? And you're just nudging the conversation based on your observations. Or, I saw when you were creating, you ran out of the color that you were using. And then what happened there? What did you decide or make in that moment? Or what was going on for you then? So you're asking these open-ended observation-based questions, and neutral being more like, wow, that person over here is a lot bigger than the person you put over here. Huh. So not assigning meaning or assigning any sort of judgment, but naming what you see truthfully and then letting them assign meaning. Silence, love it, hate it, but use it. And then knowing when it's appropriate to make the art alongside. Most of the time they'll feel maybe uncomfortable if you're not doing anything and you're just looking at them. So trust yourself around that. Some of my favorite interventions, mask making, mandalas. I know they're going to send out the slideshows, so some people are like trying to write things down, but you'll have access to all of this. Jewelry making is an easy sort of while you're talking. Air dry clay and model magic are wonderful. If you've never used those with clients, do. It's like fun and squishy and sensory. Creating yourself as a tree. I've probably at least a dozen times done the support solar system, and it's a nice non-intimidating way to show like, these are my people, these are my support, this is the teacher I really care about, this is my mom over here. Who's off the page? Who's the sun? What are you noticing about this satellite, and where are you in relation to these figures? Is very different than saying like, so tell me who's in your life, who do you go to for what? Like, to visualize it and assign meaning for them on an image instead of just talking about it can take it to a deeper level of like, why is my dad off the page? Or, oh, I forgot that friend. How did I not include them? Can bring up other things. If you do any family work, a pass drawing is really eye-opening. Of if you get 3 minutes and then you're passing your page, and what's it like when they draw over your, like, how did it feel when they crossed your artistic boundaries? Comes up a lot. My all-time favorite is draw your path. We use that in equine too. Create your path out of objects, and because you can take it so many ways. Your path here to this moment, your future path, your path to who you are as a person, your path after that breakup. So I'm gonna start this video. We're cutting it close. I know I answered some of the questions. Let me stop this sharing and then share the other screen. I just think it's a lovely way to end.
Let's begin with Will Farrell. The world is literally and figuratively on fire, and I am about to tell you that you need to make art. And more than that, I'm going to argue that the creative act is a huge part in how we extinguish and put out these fires. And I can like almost hear you. You're like, oh, Amy. That's me, I'm Amy. Amy, that is so cute and such a lovely idea. And it's so sweet that you think that making stuff is going to help the world. But I write horny fairy fantasy novels, and I really don't think that that's going to do anything. And like, I hear you, but give me 15 minutes because I want to change your mind. We're living in a culture that sidelines the creative act, that says it's something for children or something for the retired. It's an indulgence. It's a little bit selfish. It's frivolous. It's decoration. It is a narrative that is actively harming us. It is repressing our innate instincts to create. And today we're going to look at why making art is going to make your lives better and the world better. Why art is so incredibly important to you. And before I move on with this conversation, I just want to make sure that none of you are like opting out of this conversation, because I am talking to you. And I know that we use the word art and artist and we kind of pedestal it. And we say, I'm not that good. I'm not great at art. You know, I can't draw. I am talking to you today. When I talk about art, when I say the word creativity, I'm talking about anything from making a YouTube channel where you talk about your favorite Pokemon cards, to singing, to cooking, to what Pam does with gardening. The creative act, art, is anything we do where we create something with the intention to connect. So none of you are getting away with it today. When I talk about how we need your art, I am talking to you. This conversation is about you, even if you don't have a creative bone in your body. Let me guess. You're thinking about going to therapy. And as a
Or the
therapist
other thing people
myself,
always say is, I can't even draw a stick figure. That's another good one.
I want to introduce you to someone you may already know. This is Sally Rooney. She is an incredibly successful fiction author. She writes amazing books. A lot of you will have read them, and she's seriously impacted my life. And Sally says, I've given my life to writing novels. I don't know whether they are good. They are. But even if they are really good, they're not going to save the planet. Maybe I ought to be spending my time doing something more productive. And that is very possibly the case. This is what is happening to our culture. This woman who creates profound, impactful books is doubting her impact on the world. We are constantly sidelining our creativity to being something that is not productive. There are bigger things happening in the world. How could I be playing the piano? I work with thousands of creators, thousands of artists, and I'm getting dozens of DMs each week that say, I don't know how I can be spending my time at my piano when there is so much pain in the world. What I need all of us to realize today is that we need to be at the piano, making our art more than ever as we navigate these incredibly difficult things. Art is not just for kids. Art is not just for adults. Art is not just for peacetime. Art is now. We need it now. So I'm going to just go on a big rant where I tell you why every single one of you needs to be making art. Okay? We're going to start here. Creativity is the missing pillar of self-development. We are a culture that is obsessed with optimization and productivity. We've got podcasts coming out of our asses about like how to, do breath work and be the best versions of ourselves. We're looking at meditation practices, sleep practices, exercise practices. How can we optimize and be the best versions of ourselves? And no one's talking about creativity. No one's talking about making stuff. It is the missing pillar of self-development. Dr. Kieran was talking about it with comedy, with laughter. We have a huge amount of juicy research that is being, for some reason, ignored, that looks at how play and creativity and art impacts us physiologically. There's an amazing piece of research. And again, Dr. Kieran spoke very similarly about this There's a 45-minute session where people just made art. They just played around. They weren't good at it necessarily. The skill level didn't matter. 45 minutes, that was it. Cortisol levels just dropped through the floor. Exactly like Dr. Kieran said with laughter. And that is just one of so many studies that look at when you play, when you just let yourself make something, our bodies respond. Inflammation goes down, pain response goes down. If we are going to look at how to improve ourselves as humans, sure, do your 20-minute exercise, but where's your 20 minutes of playing around with the pens? Where's your 20?
All right. I know we're going to be short on time, so I encourage you to watch the rest of this. There's a part where she talks about, here, I just want to show this.
Your art, use your creations to seek the change you want in this world. Making art is activism. This is a big conversation for the time right now. This is a DM I got the other day. It says, what is the point of making art in this world when AI is just going to do it better and cheaper anyway? There's no reason to create anymore. I'm hearing this all the time. What's the point? There's no reason. What's the point? There's no reason. There has never been a better reason to create art than the incoming storm of AI. We need humans making things. The beauty and magic of art is that connection, that human connection. I replied to this DM and I said, we consume art to feel closer to humanity. Lean into the humanity behind your art, lean into the vulnerability, the mess, the imperfections. People are going to start craving it. Do not ever come to me with the excuse of AI is going to make art. I will sit you down and force you to draw something.
I'm going to pause there because I know some people probably have clients, and I don't know that I have more on my show besides like question answer and the resources. I apologize, I didn't have enough time to show her whole video, but it's in there, and I encourage you to watch the whole thing just to remind yourself that we're all artists, as cheesy as that sounds. But I really appreciate people's engagement today, because I was joking this morning too of like, how many times have I multitasked and been in a presentation but also doing 400 other things? But especially when there's an activity, it requires you to like be present, and that's what we're asking our clients to do, is just take a moment to be creative and let yourself. So the biggest takeaways, again, besides make art, is the other question and answer here was if there was activities you wanted to share with the group that you found really successful, or if you ever want to staff a case, you can reach out to me. The biggest takeaway being art is healing, in case you didn't know, and then recognizing that there are some limitations or things to be mindful of, like the materials, comments you make, and then how you store the art. So I hope that got across. I appreciate everybody's time. If you have specific questions for me, please reach out. I don't know if anyone wants to linger and do question and answer, but I don't have a curfew.
You're perfectly fine. I'm actually getting ready to go into a meeting, but were we receiving the CEU link for the?
That's in the chat. Yep.
Okay.
The real reason you're here is this. I'm just kidding. They put in the chat the like link for how to get that.
Okay, thank you. And quick question. So as I mentioned earlier, so I literally just suggested to one of my mentees, they are high functioning autistic, but they are very sensitive to noises. They're very sensitive to crowded areas and spaces, like kind of the uncontrollable environments. That's what really triggers them. So he has aggressive responses sometimes, so we have to remind him to come back. And I thought that the just even giving him that blank canvas and allowing him to create, because we've been talking about that emotional resilience and learning how to regulate our emotions, figuring out what is happening while I'm getting angry, what's in my control and out of my control. So are there any suggestions you could give me about going about this free play session that we are
Yeah,
planning?
that's a really great point, because I was talking a lot about sort of neurotypical, that some of those sensory ones can be dysregulating.
Yes.
A lot of our clients, it can be regulating and help them get out that physical need. So helping him discover what helps him release that. I knew someone once who took old records they didn't want and threw them against a brick wall to like the satisfaction of a physical release.
Yes.
Very real. And so using art to do that in a safe way. So teaching him those, we always say like punch a pillow, but he can regulate using art materials similar to fidget, like the model magic feels like something he would enjoy, where you're not clean up, but he's getting the physical release. And then even things in nature of pausing and listening and
Yes.
bare feet on the ground. So those like sensory pulling things,
Yes.
ice cube art where you're like a sensory shock can be really helpful to ground. But I appreciate you bringing that up because it's not the opposite, but it's of course different depending on the client.
Yeah,
of what
100%.
their physical needs.
I noticed so we've been doing little exercises to get him to understand being present. So we did wall push-ups, and I was like just getting him to lean against the wall and feeling that pushing, feeling that pressure. The wall's not going anywhere, but he's getting that exertion out that he's trying to figure out how to find the words to communicate.
Walls, push-ups, yeah. Or I'm thinking like, what would it be like to, with watercolor, have him track his breathing while he paints, like just slowing down and noticing his body.
So we did do deep breathing, and we did box breathing. So we did 4 seconds in, hold it, 4 seconds out, then 4 seconds hold. Okay, so all right. So I like
something visual with the activity helps him integrate it.
Perfect. I appreciate you so much, Peggy. You're the best.
Back at you.
Thank you. You have a great rest of your day. I appreciate you explaining so much, and you guys will be definitely in my arsenal of resources to keep on going back to.
Good. Love that. Put some art materials in your arsenal.
Definitely will.
I'm gonna use that instead of toolbox. Your arsenal sounds way more.
It sounds like Bob the Builder and leveled up,
Yes.
But all right, thank you. You have a great weekend. I hope everyone has a blessed weekend as well.
Yes, thank you all. I'm hoping the chats don't disappear because I want to read more about your group time. Sounds like it was worthwhile, and I appreciate
it was refreshing for sure.
Any other questions before people have to get back to their Friday fun?
Erica, would you like to unmute and ask your question?
Yes, thank you. Let me lower my hand first. Okay, there we go. I wanted to ask, are you an ATR or ATRBC?
I'm an ATR. I'm not a BC. Can I ask why you're asking?
Yes, because to make matters quite simple, I was dealing with bureaucracy at my program.
Okay.
And basically I have a semester to finish all of my clinical hours.
Oh.
So I'm looking for
yes.
So I'm looking for a site that can provide me with those hours. So I'm looking for.
I wish I could. I thought you were like calling me out. Like, what do you know? You don't have to BC, but I wish I could supervise those hours. They don't allow it to be anyone that's not board certified.
That's where I was confused. My understanding was first that they needed to be somebody who's board certified, but then they came out with somebody who's ATR is fine. So honestly, it's a little confusing.
Send me an email, Peggy at Graceful Therapy. Full disclosure, when I was gonna sit for that, I got sidetracked with other trainings that were really powerful and important to me, and I didn't feel it changes the work I do, but technically it is on my to-do list to get the more alphabet soup behind my name.
Yeah, that's the one thing I'm laughing about. Of like, I already have too many.
And our clients don't necessarily know what it means, but we know in the fields what it represents. So I'm not currently, but I can certainly let you know if that's the case. Yeah, send me a message, or I wonder if there's like Facebook groups you could post and look for that supervision from someone.
Okay, yeah, I will shoot you an email regardless. Thank you.
Yes.
I have a question. I don't know if I missed this and my neurodivergency, just like information overload, but I totally understand and obviously respect not like I use art therapy approaches, not an art therapist, don't claim to be. However, with the documentation piece, do you have suggestions of like when we like I use therapy notes to like when we like click like what modalities we use. I think I often use like art therapy skills, art therapy techniques, but I'm like, I don't know. I guess I was curious.
Really, the main thing I just tell my supervisees is like, just don't say therapists utilize art therapy, that sentence alone, but say utilize art therapy interventions or modalities or creative expression. It's not going to get you in literal trouble, or it's nuanced, but it speaks to the approach difference that there is a line there that's different, and it's almost like the capital art therapy versus lowercase art therapy. Because like I said, I absolutely use play techniques and use play therapy strategies or play therapy approaches. Is different than saying clinician utilize play therapy.
Exactly. Okay.
It's
Okay. I just wanted
subtle, but you're
Yeah.
probably fine. It's the rare individuals out there too who are claiming to be an art therapist because they love art. Or I've seen equine individuals who own a horse, and so they say, I do equine therapy. Well, there's a little more to it logistically that you're putting yourself or others at risk. So I'm sure you're probably writing it fine, or with AI helping with notes, one little suggestion will probably correct that too, just the wordage.
Okay. Thank you. Appreciate it.
Yeah, and we also want to write our notes in a way where the intervention is taken as seriously by insurance and by, society as a whole. That how many of us have worked with kiddos and the parents are like, what are you doing? Is this therapy? Does this count? So thank you for that. Anybody else? I don't want to steal people's time, but I'm here if there's other questions I didn't get to in the chat. I did put the link to the pathway to become an art therapist. There's lots of trainings and like sort of unofficial certifications available, but to become a registered art therapist, you do have to get a master's and sit for the exam for ATR, or get the hours, So that path, there's a lovely visual on the website that I put in the chat too. That would be cool if I like converted someone into an art therapist today. Okay, well, thank you all so much. Also, my husband will be proud of me. I didn't mention Taylor Swift once, and he asked if the whole presentation was going to include her. And like I could have, I'm an OG, but I have seen a presentation before that was all Taylor based. So you're welcome, everyone.
Well, thank you, Peggy. This was such a valuable and insightful training and experience. So thank you very much. And thank you, Jessie and Ismari, for interpreting and the hard work that you're doing in the Spanish channel. And thank you, everybody, for coming and joining us today. And hopefully we see you at another webinar soon.